Working in a northern Quebec Cree community in the late 70s was much different from today. For instance, we used radio telephones to call specialists in hospitals down south, meaning Val-d'Or or Montreal, when we needed to transfer a patient. We'd talk and say over, then press a button, and only then could we hear the person on the other end. Radio and TV only came to the community in 1975, the first year I was there. Fort George was the name of the community where I was based. It was located on an island on James Bay at the mouth of the La Grande River. The 4 or 5 doctors working there made regular visits to nursing stations in Cree and Inuit villages along the James and Hudson Bay coasts. We traveled by plane or seaplane or by helicopter when the ice was freezing or breaking up. The community of Fort George was later moved off the island and rebuilt on the mainland nearby. It is now called Chisasibi, which means Big River. One children's disease that we dreaded in particular was meningitis, a bacterial infection in the fluid around the brain. Diagnosis involved obtaining a sample of spinal fluid by sticking a needle in the child's lower back, and treatment was by intravenous antibiotics. Early treatment was essential to avoid complications such as deafness or mental retardation. Meningitis was most commonly caused by one of 3 types of bacteria, but we rarely see it now because we have vaccines that are routinely given in early childhood. I spent just under 2 years in Fort George. My boyfriend was working in Montreal, and my time spent providing prenatal care and helping women deliver their babies made me want to experience pregnancy and childbirth myself. I returned to Montreal, married Bruce, worked in a storefront clinic in Saint-Henri, and had the first of my 2 children. Then I went back to school to become a specialist in public health, the area I worked in with the Cree Board of Health for over 35 years.